Today we have the pleasure of meeting with Dr. Michael Denning. Michael is a doctor of physical therapy out at Children's Mercy Hospital. Michael, welcome today to talk with our students. Glad you could come on and be a part of this.
I appreciate it. Thank you for having me. I'm glad to talk about physical therapy and anyone interested in it, teach you a little bit about what I do every day.
So Michael's out at Children's Mercy out by the Legends, and as you can see, he's in a very state-of-the-art, large facility, which is absolutely amazing for your sports medicine patients. Michael and I got introduced in, I think it was 2018 by a former student of mine, Megan. She came to Michael with a knee injury, and you want to talk a little bit about what you were able to do with her?
Yeah, so some of you maybe even has able to see Megan's story. So I think Children's Mercy did a little story on Megan because she unfortunately had a subsequent knee injury. So we had the first one, the ACL tear, when she was playing softball. Had a little bit of a struggle coming back, and then because she was trying to play basketball as well on the way back through rehab, so that made things a little challenging. Made it back through, and then 6 months later tore her other ACL. And so that unfortunately is a bit of a common tale. Like when someone tears one ACL, there's pretty high odds you tear the other, unfortunately. And so she had a second one, and so I got to know Megan pretty well. So we worked together for dang near 2 years straight. And so she battled through a lot. And so that, but in all of that, yeah, I was able to start becoming more integrated with Turner High School. And so, you know, I've visited a few times, you visited me a few times, and we've kind of been able to learn from each other and kind of help kids, you know, learn more about health careers and, health careers. And so it's been fun along this whole way.
Good, thanks. So you studied at KState and got your bachelor in athletic training there. What led you to want to go to KState out of high
school? Well, it was a big school that was nearby that wasn't KU.
Okay.
To be totally honest,
Right.
I would say there wasn't anything I was necessarily like looking for, like a program. If I'm being honest, I was not that smart at 18,
Okay.
and so I didn't do a lot of research. Thankfully, when I got there, though, you know, I kind of I initially, I think, started even as a marketing major, and then switched to psychology, and I was all over the place. But you know, most kids end up switching a couple different times, so that's usually what I tell my kids now is like, don't worry about it. If you go to college, you don't know what to do, it's okay. Like, learn a little bit, see what you like. And
Right.
so mine, you know, I kind of navigated my way through a little bit, and I took a kinesiology class my freshman year. My sister, who's a nurse, actually a nurse practitioner now for Children's Mercy as well, she was like, Michael, I think you should take a kinesiology class. I think you'd like it. I was like, what the hell is kinesiology? I don't know what that is. She's like, you study about how people move. I was like, okay, that's kind of cool. And I loved it.
Right.
You know, we did all these kind of interesting labs, underwater weighing for, you know, fat composition and all this other fun stuff. And so that kind of sparked my interest. And then that led me towards athletic training. And then from athletic training is what then eventually led me into physical therapy.
Okay, cool. So after K-State, then you went and got your doctorate at Wichita State?
Yes, sir.
Okay.
Yep, shockers. So I definitely claim K-State more than Wichita State. But, you know, yeah, Wichita State for PT school, 3 years. And so it's a lot of school, but it was fun. You know, it was going through everything, you know, it's a once a lifetime experience to do all that stuff. And so especially now, PT school, it was really tough to get in back then, and it is even harder now.
Right.
So I have actually one of our techs, he's been here for a couple of years, has been trying to get into PT school. And so he's like, you know, he retook a class to try to get his grade up, and he's been doing all these things to kind of bump up his resume, his application. And he finally got in, and he's going to school in Texas, small school in Austin, I believe. But it was just a good example for me to see, like, man, it was tough to get in, you know, a long time ago, back in my younger days. And it's gotten even more rigid now. So yeah, strong applications are a good idea.
What are some things that you think a high school or young college student should be looking to add to their applications with job experience or volunteering that would make them a strong candidate?
So I think, I mean, it's kind of an easy answer, and maybe then kind of hard to implement. So I think the
Okay.
easy answer is like anything that you can get associated with physical therapy. If you can work as a tech, even if it's part time, even if it's a couple hours a week, um, but you can just be somewhere involved in physical therapy. That looks great. That's like, okay, so you have an idea of how clinics run. Um, and then if you can grow on that even more of like, oh yeah, I was a tech at an outpatient facility, something, crazy like this. And I also was able to work at a hospital. It's like, oh wow. So you have very variable experience. It's not just like you did one thing one time.
Right.
So I think that would look very strongly. And then I think on top of that, if you have, even just one element of volunteering, and if that's just in relation to the profession you're trying to get to, or the arm of PT you want to get into. So like if you like sports, yeah, I like to coach Little League baseball. Sure, great.
Yeah.
And just I think some of those kind of easier things. It doesn't have to be a chore, like of a volunteer's hours. Like, oh, I gotta go do this. It can be something you enjoy doing.
Right.
Just find something that like, okay, this will also benefit me when I go to apply, because I think a lot of kids don't do that stuff, and then you end up standing out quite a bit. And it doesn't take much effort, I think, on that back end to do those things, to make yourself stand out a little more.
Okay. So you got some experience as a athletic trainer at KState. What sports did you work with while you were there?
So I did football. Football's in the spring. So fortunately, unfortunately, we always joke. So any athletic training student that goes through that, if football that's like the big show, and so in K-State's a big football school, and so if you're with football in the fall, your life is not fun. You travel a lot, and like it's not fun travel. Like there's a lot of rules, and it's intense. I actually wanted to do those things. The timing of where I was in the program, it just unfortunately didn't work out. So I did spring, which I was kind of happy not to travel that much for. So
Right.
So it was with the football team in the spring. It was a lot of fun, and it was intense to see them do more of the recovery. And so I think that's what also kind of pushed me into more of the rehab side of it, because there was a lot of like, okay, surgery was pushed off until January after the season. Now these guys are rehabbing in the spring. And so there's a lot of that going on. And then I was with, technically, it was a shared training room for basketball, track, and baseball. And it was more so I would just kind of be in the training room, and whoever needed something, I was just there to help, versus like actually on the field.
Right.
And then my last one was like the one I was, more so like actually implementing treatments and stuff. I was just at Manhattan High School. So they had the trainer there, and there's two of us that were the training students, and we had the fanny packs on and taping ankles, and so that was fun. And again, I think kind of all these things that my history with working sports, and then it kind of led me into working youth sports, like my last rotation in college, that I just really enjoyed, and I connected with it very strongly. So that way, when I kind of transitioned to PT school, I liked PT school, but I went into it, and I will say honestly, with kind of the wrong attitude, that I went in my first day of PT school was like, I'm doing sports, I'm doing outpatient, that is it. No inpatient for me, nothing. My mind is already made up.
Right.
And that is not a good idea. I strongly encourage anyone going into that stuff, go get your information first and make a decision. I was very lucky and fortunate that I was able to, my plan worked out, that I was able to work now in just an absolute unicorn of a facility like this.
Right. So you talked about kind of how you got into it a little bit. What inspired you, like, professionally, to want to be sports medicine?
Sure. I mean, I think again, that's kind of like an obvious, easy answer. Like, to be a little cliche, is that like I like sports.
Right.
I'm very competitive, sometimes a bit annoyingly so, and so it makes the job more fun. Of course, is that like I get to stay around sports and stuff. But something I think just my own personality is I've always been one that like love to be able to lend a hand. If I'm able to go help someone carry a couch, if I'm able to be that guy, I can be like, hey, I can help you out. I get fulfillment out of that. Like, it makes me feel good to be able to go help somebody do whatever they need. And
Right.
so this is a really great job for that. To be able to, someone comes in crutches, in August, and they're down. They're like I can't imagine playing again, and they're having a tough time. And then week by week, moving more, standing, jogging, running, jumping, and then all of a sudden, like, man, I can't believe that's already been 9 months, and like, and now I'm back, and now we're done. Like, I don't have to come back to see you. I'm like, yeah, and you're doing awesome. And so, like, that whole time, you see this grow, and you see them get back to what they want to do. And so, being a part of that, like being a part of sports now in a little bit of a different way, kind of in, obviously it can't be competitive forever, but like associated with athletics and helping kids, and not even just kids, even adults, get back to what they want to do. It's very rewarding, and so that in itself was an easy drive to where I am now.
Absolutely. So with what's your daily routine look like? I know it's probably changed and adapted and pivoted since the last year of your life. I know before there'd be 10, 15 clients in there, sporting in there, training, and a whole bunch of mix of time out on the floor. How many patients are typically you seeing through the day?
So typical day for us, pre-COVID, we were around 12 to 14. That would be a heavy day for us. We are fortunate being a nonprofit in that we are, able to focus on the patient more than focused on just the numbers.
Right.
And I don't mean to knock private practice on that, because that's just the nature of the beast, that like, if you can't get yourself paid, you can't stay open. And so like they have to more so balance getting more people in and, having enough time for one-on-one. We're fortunate for us with a nonprofit that has the capacity to, allow us to do that thing, to do more one-on-one. That's great. And so pre-COVID, 12 to 14 patients a day, which is very manageable. We would do 30-minute slots, and then we would kind of overlap. So it'd be like someone at 7, someone at 7:30. And 7 o'clock, I manage my schedule, 7 to 8, 7:30 would be 7:30 to 8:30, and do it like that.
Right.
COVID comes, and so we're trying to limit people here and interaction. So we switched to 45s with 15-minute gaps. And so truly everybody had about an hour. And so we're still doing that now, just because we actually kind of have been able to improve our efficiencies. And so okay, we don't need this. We can still get a fair amount of people seen and still keep this more one-on-one. And so that's where we are right now, is about 45-minute treat. So I'm about 10 to 12 kids a day now, which is, again, manageable.
Absolutely. Yeah. So in between your patients, you're obviously charting and documenting stuff.
Oh, yeah.
Can you talk a little bit about maybe some of the math that's incorporated, or some of the documentations that you have to make throughout a patient's time with you?
Oh, sure. And so I think the level of like specificity you want to get into in your documentation, I think kind of goes to show, where you are as a clinician. And so my, kind of one of those, there's an old, I think they even give Einstein credit, but I'm not sure if it's an Einstein quote, so I'm not positive. Someone Google me on this. Is that like if you can't explain it simply, you don't understand it well enough. And so when you go to do your documentation, that should happen. I should be able to take some complex information and simply word it. However, with that, there sometimes gets to things like, the numbers and, the math that may go into stuff as well. Now, there's not a lot of just straight algebra that I'm doing in here, but there is a lot of physics that I do.
Right.
And again, it's not the same thing that I did in high school when I had to figure out, solve for X of the torque, but but applied physics for sure. So for instance, I don't know if you can see it. Nah, you can't quite see it from our location here. We'll do a tour in a little bit and I'll show everyone the lab. But just yesterday, I took a patient into our biomechanics lab. We were looking at forces through her legs when she was landing and jumping. And, calculating the forces, like, hey, look, you're only hitting with 300 newtons of force on your left foot, but you're hitting with 1,200 newtons of force on your right. Like, that's not good. And so how that translates back to me is that, like, I can document that. Like, that's easy. I can show you insurance. This is proof why she needs to come to therapy, because she has, 900 Newton difference a force during the simple movement. And so that is where being able to have these complex things and state them simply helps multiple things, because the patient sees it and they understand. They can see what they need to work on. Your documentation is very easy because you know what you need to work on. And then lastly, most importantly, insurance will see that and be like, okay, I can see how this number does not match this number, and that is easy for me to justify you should keep going to therapy.
Right, absolutely. Do you want to go ahead and do that tour then?
That sounds good. So we had a company called Matterport come through, and they basically kind of like Google mapped our facility. Might take a minute to load up here. All right, you got me there, Drew?
Yep, got you on there.
So this is what patients see when they first come in. So they come in through our little lobby. Oh, if I can turn the page. Coming through the lobby, and then I'm struggling to drive here. And so then we come in to our small gym we got here. So we got our half basketball court you step into, and this give you a little panoramic. This is the gym.
How big is this facility? Just that main room area right there?
I think it's just under 15,000 square feet. So pretty big.
Yeah.
So we'll work our way in a giant lap around this whole facility. I'll walk you to where I'm sitting right now. Right now I'm in this back corner over there. So when I come into work, I walk in, I go in that room. That is our nice boring office that no one cares about. Computers, blah, 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 typing. And then our turf, we have 40 yards worth of turf. To be fair, it is end to end 40 yards. And so if you were to be sprinting, oh, and sorry, they dropped our batting cage as you walked. Forgot about that little ditty.
Yeah.
Drop down batting cage is always nice to have. So as you come all the way to the end, so I'm walking to where I'm currently sitting now. So this interview is taking place right here next to this garage door. Looks like this was maybe taken on a snowy day. Yep. And so just our various equipment we have over here, we don't really have time to go through all of it, but a lot of fun toys. But having this turf is really, really invaluable. And then all of our plyo boxes, additional turf space, kind of a larger area we can do a lot more cutting on as well. And this is sporting sides over on this side of the gym. We kind of fly all the way over here. So sporting trains here, they are alongside our kids. So they come in and they have their different training times, and they come in and they'll hop on their bikes right here. These are the sporting bikes, but our kids are allowed to use them too. So a lot of people, Graham Zeus, he's a popular name from sporting, is what Johnny Russell, those guys, they're in here and they'll be on this bike and you might be sitting on the one next to them. Now with COVID, we've tried to be a little more spaced out, but It has happened many times. Like you might have to share the leg press machine with a sporting player because he's trying to work in too. And so, which is awesome. That's just like a fun experience for the kids to have as well. Absolutely. And I will just give lots of credit to Coach Vermees and his team that these guys are great. They are really, really respectful and do a really great job of helping us share the space and keep it looking nice and just they sacrifice their own time. Like, oh, if you need this for your kid, they go do it. I'll come back. That's fine. And so they're all of the players. It's been really, really great to have them here. So if we continue our circle, treadmills, bikes, our pool is awesome. Can I hop in there? Yep. So these two pools are sweet. So we have the HydroWorks 3,500 and the HydroWorks 2,000. So that's in gallons. The 2,000 is the super cool one. This is a zero depth entry pool. So this whole floor raises up to the ceiling, raises up to the floor for a zero depth entry. And then it drops all the way down to 6 foot. It has 4 HD underwater cameras. So you can have 2 front view and 2 side views that will be displayed up on the big screens right here. And then there are 2 jets that you actually turn this into a turbine and swim. You can have just continuous swimming in that pool. And then that pool over here has a treadmill down on that corner. couple cameras and a couple jets as well. Still very, very useful. Excuse me. This pool, just because it can do so much, is really valuable, especially if you have an athlete who's, some gymnasts are pretty short. You have a 4'10", 15-year-old. She really can't do much in a 4-foot water over here. And
Right.
so this pool becomes much more valuable. And so just things like that, it just helps quite a bit.
So with that zero depth, knee patients can just walk straight off the pool deck onto the.
Yep. I had a girl who was on a walker. And so, sorry, excuse me. Had a girl who was in a walker. And so she, for one, she was scared to even move. And so she just took her walker out there, stood still. I was like, okay, it'll be all right. And just lowered her down. No problem.
Good.
So see if I can buzz this through here pretty quick. All right. A lot more equipment. We have some Pilates equipment here. The room is currently shifted a little bit, but we don't have time to get into all this. But I strongly encourage anyone interested in any element of health, fitness, or sports, you need to educate yourself in the world of Pilates. It is a horribly underutilized modality as far as rehab and training goes. And if you want to be a better athlete, you should do this stuff. That's my plug for Pilates. Our Biodex strength testing machine. It's an isokinetic machine. It actually does a lot more than that, but we primarily use it to strength test our ACLs for quad and hamstring strength. You sit in the chair, leg gets attached, and you kick and pull, and it measures how hard you can kick and pull.
Right.
And then more Pilates stuff. And then here are the above ground force plates I was referring to.
Yeah.
And then here is our human performance lab. So in this lab, go through the net here. Woo! In this giant lab, all these cameras up on the wall. These are motion capture cameras. There are 19 of them, but I think we have an additional 2 if we need them. And so you get the reflective markers put all over your body like they do for video games and action movies.
Right.
And then our lab coordinator, her name is Jen. She is sprint, run, cut, jump on those force plates while you're getting your movements analyzed. And it can show you moved your shoulder at this rate when you had this much pressure on your left foot, and as complicated as you want to make it.
Right.
Now, I would usually tell people it doesn't need to get that complicated, because the more complicated you make it, the more math and everything else you have to do to analyze that data. Oh, we're stuck behind the net. How do I get back? It won't let me go. There we go. So, and then we have completed our loop. There's a little more to this building, but again, for the purposes of our little video podcast, I think this is a good point.
Exactly. Yeah, that's good. That's really cool. So then out in the middle, you have all your free weights, ellipticals, treadmills, kind of out behind you over your shoulder there.
Right.
Some medicine balls, all that kind of stuff. What's something that is just a general product that you like, a product that you love to have and train people with?
So this facility, I'm trying to think back to the number. This complex, I think, was $80 million.
Okay.
For the building, the fields, our stuff, everything. $80 million. And that's not even a real number, $80 million. That's a stupid amount of money. $80 million. The thing I use the absolute most is this $19 exercise ball. This is the most versatile piece of equipment in this gym.
Okay.
By far. It's not even close. The foam roller is probably getting close to being a comparative, and again, about $20.
Yep.
So you give me that, some bands, foam roller, this, and some bands. Yeah, I'm good. I can do everything I need to in a little space. All the stuff that we have here is excellent. It's so great to have this as a resource. But it's one of those things that, like, as a teacher, you could probably appreciate this too. It's nice to have the bells and whistles, but if you can't teach it, it doesn't matter.
It doesn't matter.
And so if you don't know what you're doing as a therapist, you can have all the toys you want. You don't know what to do with them. And so, to be honest, when I first started here, I was overwhelmed. I was like, holy S, This is a lot of stuff. I don't know how to use some of this stuff. The
Correct.
power plate, this thing that vibrates on the ground. Like, what the hell do I use that for? And I kind of have an idea of what to use it now for. But again, you kind of like, okay, let me start small. What do I need to use? And honestly, I always come back to the exercise ball, Swiss ball, physio ball, yoga ball, whatever people want to call it.
Right.
Just because the level of control and strength that it requires to use properly, it challenges everyone of any type of physicality that you are in the spectrum. I can kick your butt with that ball.
Right. You kind of joked about not being very smart back in high school earlier. What's something you wish you would have known then, or maybe early in college, that would help you with your current position?
So many things. I would say take your math seriously. There's a lot of math that I'll admit that like I don't do imaginary numbers. What is that, the negative square root or something? I don't know. That was a waste. to relate to some high schoolers right now, like I'm sure it matters in some element of some career, but there are some things where I'm like, that didn't help me. But there's a lot of math, most of the math that I have to go back on now and trying to like brush back up on. Like when I'm doing my forces for my kids and that stuff, I'll have to have Jen walk me through. I'm like, hey, all right, so remember force equals mass times acceleration, but what was, and so like she's like, here, let me explain it to you. And so things like that for where I am now, if I could be a little more brushed up on that, I would be in a better spot, because going back to the whole quote of like, if I can understand it, from a deeper level, I can explain it better, and then I can improve my patients on whatever they need. So I think that's one thing. I think another one, this is more of a subsect of biology, but anatomy. And so if I were to pick something over anything but math, I would say anatomy. I know officially anatomy 1 and then math is 2. Knowing your anatomy is absolutely paramount to be even a bad PT. Like that's where you have to start from, is have a good anatomy knowledge, and you're starting at the bottom.
Right.
Then from there, everything else is all clinical. But if you don't have a good handle on anatomy, you probably should go take it again before you start here. My wife just took, she's actually a Pilates instructor. So to go back to my Pilates plug, it's a little bit of a biased opinion. However, I learned so much from her.
Okay.
So much. And she just had a little anatomy review and stuff, and she wants to go back through it. And I'm excited to go back through it, because I'm like, boy, anatomy of the hip, that is a lot. I would like to go back through it. I've been doing this for almost 10 years now. And I still don't think I have my anatomy down to where I want it. Which that's good, right? That's my competitiveness, that like, no, I'm gonna be better. I'm gonna get better. And so I want to keep working at that. And so I think, for my profession, I think math is often overlooked. And then 2, the anatomy is huge.
Right. The human body is so complex. There's so much to even just divulge into. Even
Totally. Yeah.
Just the hip, like you said.
Right.
It's a tenth of your body, maybe.
Yeah. Right.
So for high school, young college kids, what's a book that you might recommend if they're interested in PT, something that they might want to check out?
So I know there's one book that got really popular within the world of CrossFit for a while, called Supple Leopard, which I think you're familiar with that book as well.
Yep.
I will say this: if you read that book, it has a lot of good takeaways and good concepts. However, I would then also encourage you to go look at modern research, because there's a lot of stuff in there that was actually disproven. However, the Supple Leopard does have some interesting ideas, and just kind of taking some, very, very old thoughts of exercise and combining it with some really kind of cutting edge theories with stuff today. The other book that is going to sound horribly boring but it has a lot of really good information in it. is the NSCA, so National Strength Conditioning Association, their CSCS textbook, so the Certified Strength Conditioning Specialist textbook, that you use to study for if you want to take the CSCS exam.
Right.
A couple years ago, I studied and took that exam. And to be honest, the exam is really not that tough. Like, if anyone gets worried about any kind of certification and like, oh, I don't take a test, it's really not that hard. It was like, no offense to anyone that has it, it's great information, but the exam itself is not horrible.
Nothing compared to your doctoral programs.
Nope. I about vomited going into and leaving that test.
Yeah.
But that textbook for the CSCS has a lot of really good digestible nuggets of information, because they have a chapter on nutrition. And so you could read just that chapter and take a fair amount away from it, and it could help you in whatever area of health you're looking into. And they have, strength testing, then they have programming, and, it's everything broken down. And it's very well organized. And again, it's digestible.
Right. So with that, as a physical therapist, what type of professional development do you do yearly, or how does that work?
So it's state dependent.
Okay.
So state of Kansas requires 40 hours of continuing education every 2 years.
Okay.
So those continuing education credits are governed by the Kansas PTA Association, Kansas Physical Therapy Association, and then the APTA. So like, if you take a course that is credentialed by those governing bodies, it counts towards your 40 hours of credit.
Right.
There's a variety of ways you can get them. There's a lot of free stuff you can just hop on and like, oh, you watched a webinar, you get one CEU. A lot of times they're paid. And so Children's Mercy is great, and they offer, they cover a little bit of our yearly costs.
Okay.
It usually gets you about halfway through, that's great. And with COVID, there's actually a lot of cheaper online stuff. So I was able to finagle a little more hours
Right.
here and there.
Absolutely.
And then, so basically it's just those 40 hours every 2 years. I think Missouri is the same actually, but per state can vary a little bit within that.
Okay. Do you want to talk a little bit about what you guys are doing this spring and last fall with your panels for high school athletes, the conference you guys hosted?
Yeah, our young athlete conference.
Yeah.
Yeah. So unfortunately, COVID didn't have it last year. That's a bit of a record on repeat. But yeah, typically what we like to do for our conferences is that we will do like a season for sports. So I think this year we are doing fall again. So it's fall back into sports. So nice little play on words as COVID is winding down right now. And so they'll be focused on, volleyball, football. What is some of the other? I think soccer get touched on. Soccer is kind of anymore doesn't really count because soccer is year round.
Right.
So we typically do by the season. And so then over the couple of years, we try to hit every element of our sports population that we can. And we try to even throw in some fun ones just for something interesting. So like we had rock climbing one year. Nice. We had a guy come from Colorado and talked about these like bike mud run weird obstacle course thing that like I guess is growing in size, and he's seeing more injuries from it. And so it's just these interesting elements of sports. But I think what's really great for those conferences that we have these fun lectures. That sounds like oxymoron, but they're fun. And then we do breakout sessions. So we lecture a little bit, and then everybody breaks out. And so we have, different presenters who do different things. So I presented on wrestling biomechanics a couple years ago, and actually was able to use the lab. It was really, really fun to put my wrestlers in a bunch of dots and have them move around and see the kind of crazy positions they get into, and then have that get analyzed of their movement. And then I led the breakout session, and everyone came by. It's like, hey, when you're rehabbing a wrestler, we saw on the biomechanics of his movement, he gets 160 degrees of knee flexion. That's important because if you watch him shoot, and you kind of just, now I'm taking this lecture and now applying to like a lab like you do in class, and have everybody move and do these things. And so it's great because it's a little more interactive. So we try to broadcast that conference not to just PTs or not to just doctors, but to coaches and trainers and anyone else that's really involved in sport in any fashion, because I think you're going to be able to take a lot from it.
Yeah. All right. I got 2 more questions for you. They're kind of fun little ones. So everybody thinks of a PE teacher as somebody that just gets to play games all day with their students.
Sure.
What is a benefit that you get from being a physical therapist?
I get to play games all day.
That's right.
I will say I'm a little bit of the butt of a joke sometimes, because for one, I get bored just all day just typing, and so I got to move. And so I'm competitive. I like sports, and so I have my little challenge games that I do with my kids. And some of the other therapists will laugh at me because they're like, Denning's going to go play horse or whatever.
Right.
Which my jump shot's gotten pretty good. And so, sorry, 1 second.
Your next girl is here. Do you want me to start her on something?
I was gonna just wait for just a few minutes.
Okay.
Yeah, thank you. My next one's here. So anyways, yeah, it keeps me, kind of involved more, but honestly, it ends up having like a nice kind of fun element to it, because all of a sudden, it's like the competitive part of these athletes come out, and they're like, I can beat this old guy, and then they don't. I beat them. But we'll play our balance games, a little soccer game, and just kind of do these things. And what's great for me is that I end up using it as like motivation. Like, all right, hey, if we can get this stuff done, we'll go play horse, and then loser has planks, or whatever. And so when they do beat me, I'll do my planks. So I'll take the punishment.
Right.
And it's fun. And then like, though I had one kid, he's a baseball catcher, and this kid throw smoke, and he scared me. So we would play this football game of playing catch, and he kept the tally. He had like on his phone. He's like, no, it's 3-4. I'm up 1. It's like, all right, whatever, man.
He's ready.
Yeah.
And then the last question I have is, if you don't like blank, then being a physical therapist is not for you.
Ooh, that is a good question.
So like a previous person said, an athletic trainer was, if you don't like feet. Then
Yeah, that was actually one of the first things that came up to my mind right now.
Right.
So as far as I would say, if you don't like talking to people, like if you're an introvert, this job would be very challenging. Not that introverts can't do this job, but in this type of setting of like, if you love sports and you like being around people, it could be a little more of a challenge. I am very extroverted. I talk all the time, and so I process things externally, and that's just my personality. And so I think a lot of times that's good, because athletes tend to be that way too. But I have some, like right now, I have a few kiddos who are not. They are the opposite, and I struggle to connect with them. So if I was much more introverted and just kind of like to stick to myself, not that that's bad at all, it would just make this job much more challenging to interact with people, because a lot of times those interactions build the trust and rapport, and then all of a sudden you have additional information come your way, because I had someone recently told me about, they have like some issues going on with adopted parents and stuff. I'm like, oh boy, I need to know that information, because that can be good for me to be sensitive to this, as well as maybe you can't get a ride to PT because you have other things going on. So I'll be aware of this. So like all these other extra elements that when you have this connection with those, that a lot of time my extrovertedness, I feel allows me to have that, ends up being, in my opinion, more of a benefit.
Awesome. Well, hey, thanks again. I'll let you go get back to your clients. You got to do your job. I want to thank you again for just spending so much time and talking about what you do on a daily basis. We really appreciate it.
Not a problem. Happy to chat with anyone. If anyone has any questions, Sir Drew can leave my email for whoever needs it. And so, yeah, feel free to reach out. I can talk with anybody about anything.
Awesome. Thanks, buddy.
Thank you. Appreciate it.
We'll see you later.